Hi, my name is Christian Flotter and thank you so much for joining me here today. Today I'd like to talk a little bit about tongue ties. What is a tongue tie and how can you tell if your child may have a bit of a tongue tie going on? Well, tongue ties themselves fall within a category known as oral tethers. See, it's not just the tongue. We can also have lip ties or cheek ties or buccal ties. There are many things that can get tied up inside our mouth. And that's the problem. Inside our mouth, if we have one of these ties going on, it can restrict the movement of certain tissues inside our mouth. Now, if I restrict the movement of these things, what's something that's going to be affected by that? Feeding. So it's often in breastfeeding or even with bottle feeding that we see the greatest impact of a bit of an oral tether occurring. So let's talk about tongue ties. The anterior tongue tie is the part where we see, you know, that little frenulum underneath your tongue, you know, that little bit that dangles underneath the tongue there? That gets too tight and it stops the tongue from being able to move forwards. So when we're doing a particular test known as the tongue extrusion reflex, a normal baby is meant to be able to stick their tongue out like, If we've got this tongue tie going on, an anterior tongue tie will stop the tongue from being able to do that. Now this is important because in breastfeeding and bottle feeding, we actually use the tongue to help find the nipple and bring it back inside the mouth again. So with an anterior tongue tie going on, we often find that this ties in with difficulties with the attaching process. You can have a look for the tongue tie in other ways as well. When they're crying, for instance, the tongue should have a nice U shape to it. But if the front part of it's too tight, it's getting held in place. It turns into a bit of a V shape. Or when they're sticking their tongue forward, the outer aspects might come forward, but the inside still stays in the middle there. So it looks like it comes around like so. So that is the anterior tongue tie. Now, if the anterior stops the tongue from going forwards, a posterior tongue tie stops the tongue from going up. See, the tongue itself is quite useful when it comes to particular things. In adults, we use it for talking, but for everyone, we use it for swallowing. Now, the tongue itself pushes up against the roof of the mouth, and it is this pushing against the roof of the mouth that helps to create what's called a negative pressure or a vacuum. So when the tongue drops down like this, it brings milk, it sucks milk into the front of the mouth before waving away and allowing us to swallow it down the back of the throat. With a posterior tongue tie, we cannot lift the tongue up quite as well. Now this then stops the ability to create that negative vacuum or that negative pressure. If we can't create that, we have a difficulty when it comes to suck strength. If we're not properly sucking back, we can end up with too much in our mouth and we can end up choking or coughing. If we don't swallow it down properly, it's got to go somewhere, we might dribble it out. Or we might produce a bit of a clicking sound because we're utilizing other parts of our mouth to compensate for that lack of motion going on inside of the tongue. So how can we check for these things? Well, your IBCLC or lactation consultant will be trained to be able to look for and give you the best advice regarding these oral tethers. As a chiropractor, we look for changes in tongue motion. See, this is another aspect that can be coming into play. The tongue itself is just a muscle. And like any other muscle in the body, it can be influenced by the neural control to it and the structure around it. So if it's not moving properly, that may also reflect as changes in normal breastfeeding. But if you suspect that your child has a bit of a tongue tie going on, or if you're experiencing some real difficulties when it comes to breastfeeding, your IBCLC is the way to go. Have a chat with them and find out what else could be done. If you have any other questions though, you can always ask Dr. Christian.